The internal work was one of the great skills that Birthing Better families utilized. We did not develop the internal work skills. They actually came from a male obstetrician who became a lay midwife. His name was Norman Casserly, and he was absolutely brilliant. Because he had been trained as an obstetrician, he really was deeply aware of all of the aspects around pregnancy and childbirth. He knew that the words normal, natural, and physiological meant that anything that could happen might happen. And he knew that risks were real. And he knew that there were many known and unknown risks, and that risks could lead to problems, although most didn't. And he also knew that most problems resolve themselves or can be helped by what we do to help the problem resolve, and that few problems result in tragedies, but they can. The internal work was acknowledging that an area of a woman's body that this big grapefruit-sized object has to pass through is just soft tissue. There's no bones in our birth canal. However, it's really difficult for women to both visualize their birth canal and also relate to our birth canal. Men have an advantage. Everything is out front. So if a baby had to come down, out, and through a penis, you'd see it. And every man would say, I'm going to prepare that. But it's happening on the inside of women. Until birth, the baby may have entered the inlet of the pelvis, which is right above the pubic bone. But as I said in another video, you can't reach all the way back to that inlet shape, which is in the inside of your hip blades and the mid part of your sacrum. You can only feel right the beginning part of it right on top of your pubic bone. But your baby comes into the inlet of the pelvis, and then it has to pass through the mid-pelvis. You can feel that when your doctor or midwife does an internal. They are feeling for the mid-pelvis what it's like. And that can be the narrowest part of the pelvis. In another video, we talked about mapping the outlet, curve of your pubic arch, the distance between your sit bone, the distance between the pubic arch and your tailbone, what the shape of your sacrum is like, whether you have a nib of a tailbone or a large tucked under tailbone. That's the bony pelvis. But the internal work is in the 3 inches of our birth canal. It starts where the cervix and the top of the vagina is. And at the back of it is the lower part of the sacrum and the tailbone. And the baby, when the cervix is fully open, comes down into the top of the vagina, the birth canal. If the baby needs room, it pushes the sacrum out and back as it moves down through these 3 inches. When you look at a pelvis, a male or a female, you see these big ears in the back. The sacrum is here, and these big ears have connective tissue and muscles. So when you pull your sit bones together, you are tightening up those muscles. We call those the Minnie Mouse muscles. When the baby is pushing the sacrum back and out, those muscles are at the top part of the birth canal or our vagina. And when we feel the baby moving our sacrum back and out, the baby is coming down on top of our rectum, and it makes us feel we're going to move our bowels. And sometimes we do. And that is when the baby is moving through the mid part of the bony pelvis. Once the baby has come down to the top of the vagina, it turns under the pubic bone. That orients the baby's head to the vagina, which is right under the pubic arch. If it came straight down, it would open up the rectum, but it doesn't. It curves under the pubic arch, but that puts a lot of pressure on the back tissue behind our rectum and on the sides of our rectum. This is the lower part of the birth canal. Once the baby moves into the lower part of the birth canal, you can see the baby from the outside. It's just a little bit of baby during a contraction, and then as the baby moves further, the baby begins to open up the outlet or our vagina. That's where we experience the ring of fire. So when we do the internal work, 90% of fathers or others will do it on us 5 minutes a day from 32 weeks onward. It's vitally important. There are some religious communities where men will not do this. and women do it themselves. And the way we do it ourselves with a big belly is we tilt our belly to one side, we use the thumb to the opposite side, and we work on that side. And when we're finished, we tilt our belly this way, tuck our arm under our belly, and work with our other thumb on the opposite side, the way that the thumb is pointing. And believe it or not, we can get way back to the back behind the rectum. The women in the religious communities that do it themselves will often say in second stage, I did my homework. And what they're saying is they can feel that their vagina is opening and not stretching. When you've done a lot of the internal work and worked with the birth hormones, your vagina opens like a lotus flower. It doesn't stretch. And second stage is profoundly cut down. So you have to be prepared because there's no constriction in the soft tissue caused by tension. You also have to work on that vaginal opening where the ring of fire is. And we do that by doing it this way or with our thumb this way. And we work on that so that that last opening will open up and not stretch. The perineal massage that people have talked about is only from that opening to the front of the rectum, and that isn't sufficient. We need to work into the depths of our birth canal. Men are inside us. They know us. In fact, every woman has given birth to every man and every woman. So men have an intimate knowledge of birth and our woman's body. There's never been a woman who has been inside a man's body. So men have a huge amount of knowledge. They just need skills to help. And they're happy to do it because men are fascinated by pregnant bodies, fascinated by the birthing process, and want to help. They do not want you to be pissed off at them or disappointed. They're human beings. They want to have skills to help you birth their baby. Women have the same fascination with men's bodies. And so let's work together. So the internal work from 32 weeks onward, 5 minutes a day. You can do it either lying down, sitting on the toilet, standing up with one leg up on a small bench. Now there's one other element of the internal work, and that is learning how to check yourself. As I said before, if men were giving birth, you would see the baby's head coming down through their penis. Nothing hidden there. Nothing hidden there. But for women, it is all on the inside. And many women in labor will say, I don't know where I am. A lot of people will go, well, you're in the shower. That's not what a woman is saying to you. She's saying, I don't know what is happening on the inside. There is a reflex that is called the cloacal reflex. Bluntly, it's the asshole to the brain reflex. When you've done the internal work, you need to check yourself. In Australia, doctors used to check women's dilation by going up through a woman's rectum because the rectum is in the middle of where that top of the vagina is. So if you go into the rectum, you can feel more of the top of the vagina. If you go into the vaginal opening, you can only feel the very front of the top of the vagina. But it's intrusive to have a rectal exam done when you're in labor. When you check yourself, you want to do it with your middle finger if you're doing it yourself. You want to put your middle finger in so it touches the front of your vaginal opening. That's where you pee. And you want to slide your finger up, and you'll realize that the pubic bone isn't like this, it's like that. So you're going to come in and the pubic bone's like that. To get to the top of your vagina, you have to go up and then you'll feel the tissue there. So you ultimately are turning your finger around, going up and feeling the top here. You are fully dilated. When that top, you can feel the cervix pulled all the way back to inside of your pubic bone. If you slide your finger back, you can reach a cervix that is about 3 centimeters dilated, which is about like that. When we check ourselves, we are not checking in the same manner that a midwife or a doctor is for how dilated or how effaced, how soft that tissue is. We are just checking for change, and that's important to understand. Perhaps more of the baby's head is lower down. Perhaps instead of being puffy, that tissue is slicker. Perhaps instead of feeling a cervix that's like this, it's now flush with that tissue. Or perhaps you couldn't feel the cervix and now you can, because the cervix rotates more forward when you go into labor. You are checking for change. If your partner checks you, then they need to articulate what change they feel. But when you check for change, it helps you understand where you are and why the contractions are how they are. Often we check when our labor changes to us. And then we check to determine what that change we felt means to the inside of our body. There was a woman who was one of the Birthing Better families who was a midwife, and she had 5 children, and she said that she just lost it. She didn't know where she was at a certain point in labor. And then she'd start to push, and then she'd know where she was. She was pushing. So she had never thought about checking herself, because midwives are being told, don't check women. So we're not checking ourselves either. Well, that's silly. We need to check ourselves. And it's okay if someone else checks us as well, because it helps us understand where we are. Now, we use terms like 3 centimeters dilated, 50% effaced, and your baby's in a +1 station. We don't understand that. But when you feel a curve of a baby like that, it's down there. And when what was puffy is now very smooth, that's change. When before you couldn't find the cervix, and now you can define an arc of the opening and then create an image of that arc, we know where we are. So we worked together. She learned how to check herself. And when she had her next baby and she found herself saying, I'm at that point where I don't know where I am, she put her finger inside her crotch and she could feel that the baby had come down into the top of the vagina. There was no cervix. She was fully dilated, and her body was moving from contractions that dilated her cervix to the contractions that would push the baby out. And once she felt that, she knew exactly where she was, and she filled in that gap. You can do that as well. If you don't want to check yourself in front of a care provider, go into the toilet and enjoy it, because we connect our brain to our body and it helps us to know where we are.